Hi, Dr. Traci here. Today we're going to talk about how to start therapy on the first session. So, in the beginning, starting that first session can be pretty intimidating. And a lot of us, especially in the beginning, and if we're younger, we can have imposter syndrome, which is really difficult to feel, but you will eventually overcome that, I promise. But on the first session, it's actually going to be, or should be at least, one of the easiest sessions because what you want to do mostly is just listen, right? You want to find out what brought them here, why they wanted to participate in therapy, what they want to accomplish in therapy, or how they want us to help them. And then you want to find out like what they're experiencing, why they're experiencing it, and how they're experiencing it. Like if there's any symptoms, like how is the problem actually affecting them? And that's pretty much it. And that takes, that will take about the whole hour, if not more sometimes. And so in the very beginning, when they first sit down, you just want to make sure you're creating a safe, welcoming space for them and ask them. The first thing I ask is, hey, let's jump right into it. I don't like to waste their time or my time or their money. So we jump right into it and I say, what brought you here? That's like probably the most common question that most therapists use. So they'll, most of the time, about half the time, the clients will just roll from there and tell you everything that's going on without a problem very easily. The other half of the clients will say, well, I don't really know where to start. I kind of don't know the process or what to do. And I immediately just try to calm their nerves because you also have to realize that first time in therapy, or even if it's not your first time doing therapy, but that first session is very, very stressful. It's likely they had anxiety or some sort of stress leading up to that session and probably didn't even sleep well the night before, kind of stressing, just anticipating that first session of therapy. So if you keep that in mind, you really, it can help us just kind of put them at ease and be a little bit more open and welcoming and calming and just very supportive, especially in that first session. So once they come in, so if they say that they're really not sure where to begin, I just immediately kind of like stop them, I calm them down, and I say, you know what? That's why you're here. That's my job. You don't have to know what to do. How about I start with just asking you some questions? And you can see them kind of immediately kind of, okay. And I'm like, just deep breath. We are here. We are doing this together. We will figure it out. And that alone just helps put them at ease, and it helps them become more open to the process and to you. And that's where we're also beginning that rapport. We're building that trust. Right? So with clients that aren't going to easily tell you everything in the beginning, some of the questions, let's go through some of those. So I'm going to ask, what is there something that happened that made you make the appointment? It's like, what was that triggering event, that situation that actually made you, get online or call me, text me, whatever it is to actually schedule the appointment? That's usually going to be a big indicator, although it's not going to be the start of it. Right? So, but that is going to be a big indicator somewhere for us to start in therapy. And then what I do is I work my way backwards. Now, let me just add that I know psychologists and master's level therapists are, from my experience, are trained pretty differently. We're trained more in a psychodynamic, psychoanalysis way of like digging to the past, often as far back as childhood. The stereotypes are true. It's all about our mom. It's all mom's fault. No, just kidding. Well, about 80% that's true. But anyway, so, we dig, and that's how I work. But it's not right or wrong, right? That's the kind of magic of therapy, because there's no right or wrong way. We just kind of have different methods of getting there. But our ultimate goal is usually always the same. So So what you want to do is try to figure out what's happening in their life, what they're experiencing. And what they're experiencing, right? We're looking for symptoms, right? We're looking for things like, how are they managing day to day? Are they waking up? What is their day-to-day schedule like? Their sleep, their eating habits. Are they working out? What is the dynamic? Do they live alone? Are they living with other people, family or friends or whomever, a partner? And what is that dynamic there? What is their work life like, their social life, their support system? You want to get a sense of how they function day to day, and that's going to give you some indicators. And in the back of your mind, you're going to be kind of marking off those symptoms for diagnostic purposes. And we will go through some tools for diagnostics as well. But that's what you're kind of doing in the back of your mind also. And you want to see how well they're functioning. So once you have that, you want to kind of go back and say, the way I do it is I say, well, when did this first start? When did this stress first start? When did these symptoms all first start? When did you start feeling badly? And, they'll kind of give you maybe a time, some sort of timeline. Some can be really accurate. Others might say, I'm really not that sure. And if they say they're not that sure, you can say, well, do you remember like last year about this time? Like, what about your birthday or around the holidays? Did you feel this way? You want that length of time is also very important. Also, you want to know how long they've been struggling, right? But that's also important diagnostically. So with that, and then once you get some sort of, and by asking them about like pointing to their birth date or like a specific time of year, like the holidays or New Year's or something like that, or even a grade level or like a time in college or something like that. But that's what that does, is that helps anchor them. And instead of remembering like, oh, it was 6 months ago, or if it was a year ago, it's a lot easier for us to kind of say, oh, wait, you know what? I remembered that was when I was, a sophomore in college, or that's about the time I started that job, or that's like a little bit after I, got married or something like that. So it helps them put that timeline together a little bit. And then you want to ask, what was going on in your life around that time, right? Because that's the indicator right there. And I'm a big believer in not just treating the symptoms, right? To me, that's just symptom management. And we're not going to, really make progress to heal the underlying reasons for the symptoms. So I want to dig back as far as possible to really be treating that underlying problem. And so then it'll start to get their brain, and a lot of times there'll be like this kind of epiphany, and they'll say, oh, that was, when I started my job, or when I got married, whatever it might be, or when I got divorced, or, something like that. So it could be good things, it could be bad things. It doesn't, sometimes it doesn't really matter. But that is sometimes also not the underlying cause either. That could have been maybe a later trigger in life to an even earlier cause, but that's going to come a little bit later. But just keep that in mind. You're not going to stop there with the digging, if that is your method. Also, in the differences between how psychologists are trained and most master's level therapists is they are usually more present, like today, like how can we get you well today, managing your symptoms, managing your stress level, coping skills, problem solving skills, emotional regulation, things like that. In which all of that is very important. And we do that also, but we just usually dig further back. And again, these are there's no right or wrong, and sometimes there might be clients that say, what, I really don't, I'm not ready to go back there. And that's okay too, because again, we always remember, we're always meeting the client where they're at. And so if they're not ready to go back there or address something, perfectly fine. And tell them that, make sure that they know that they are in charge. We work for them. It's not the other way around. We are a team, we are a collaboration, and we're going to talk about that a little bit more in an episode discussing like person-centered therapy. And so that's a little bit of kind of where to start. And anyway, I hope that helps, and we will have more of these discussions. Please comment, ask questions, recommend topics. Thanks.